Concussions often go undiagnosed and unreported, but the National Institutes of Health estimates there are 300,000 sports-related traumatic brain injuries in this country every year. Many of the victims are teenagers who are often eager just to get back in the game. Jerika Duncan is at the Inwood Academy Gym, that's here in New York City, to show us how doctors are exploring ways to speed up the recovery. Jerika, good morning.
Good morning. The basketball court is just one of the places where doctors have seen an increase in concussions among young people. At the moment, there is no specific treatment for concussions, but researchers at the University at Buffalo are looking into whether prescribing exercise might just be that magic pill.
Now, is that giving you any symptoms, Cameron?
Nope. At the Jacobs School of Medicine and Biomedical Sciences,
now go backward.
Dr. John Letty evaluated 16-year-old Cameron Sullivan for concussion symptoms. In early December, the high school junior got that concussion, her first, playing basketball.
I was going to take a charge, and a girl went up for the layup and pushed as she went, and I fell back and slammed my head against the ground.
Does that hurt?
No.
Letty examined Cameron and invited her to join a new clinical trial on acute concussions among teens between 13 to 17, the age group that takes longest to recover.
Okay, can you go a little faster?
Yes.
Unlike most concussed patients, those taking part in the trial are prescribed exercise days after the concussion instead of just rest.
In one study, we showed that the exercise actually changed their brain from abnormal to normal.
It changed their brain.
Changed the blood flow in their brain from an abnormal pattern that we saw with concussion to a normal pattern that we saw with healthy people.
So Cameron walked on a treadmill every day for 20 minutes at a gentle pace while monitoring her heart rate. How could this be a game changer?
We don't have any treatment for concussion right now. There's no pill you can take. Really, all you can do is sort of wait until the symptoms go away.
But in this case,
we're hoping that by engaging the beneficial effects of exercise on the physiology of the brain, that this will actually speed recovery in kids with acute concussion.
A concussion occurs when a blow to the head causes the brain to move inside the skull, which can change the way the brain functions.
You see the spinal cord coming up into the brainstem.
An MRI or CAT scan typically doesn't reveal evidence of a concussion, and teen concussions often happen as a result of athletic activity.
The power of this study is it's in younger athletes.
Pediatric neurologist Barry Kosofsky of New York Presbyterian and Weill Cornell Medicine says he's eager to see the study's results.
Yes, let's have some guidelines and try to get them going faster, and everybody can benefit as long as it's done in the controlled way.
16-year-old goalkeeper Julia Whipple was one of the first to enroll and successfully complete the trial. Back in September, she collided head-on with an opponent. As an athlete, was it hard to not want to push yourself a little bit more than you should?
It was extremely hard. I'm always used to doing workouts with my team and running around, and so walking around every night at a specific pace was it was hard because I knew I wanted to go faster.
Dr. Letty says that's the biggest challenge.
The risk is that someone who is doing this approach could do it too aggressively. That's possible.
Has that happened yet?
It's happened in some of my patients, but they learn pretty quickly that they can't really push it too far because they get symptoms.
Julia's mother says she's glad to see her daughter is healthy and is hopeful this new treatment will help young athletes safely compete again.
A lot of damage can be done by these concussions, and the more information you have, the better. It's your kid.
Now, Dr. Letty was adamant that if you suffer a concussion, you shouldn't go out and exercise. Remember, this is a study that they're conducting, and it will be at least another 8 months to a year before the results come in. Nora?
All right, Jerika, thank you. That's really important information.
We both shook at the same time, Nora, because that mom had the best point. The more information you have, the better it is to help the kids.
Thank you so much, Jerika. Great reporting.